Start the examination by washing your hands. Greet the patient and ensure that a chaperone is present. Obtain adequate exposure, initially ideally to underwear, to assess gait. Ask the patient to take a few steps, turn around and come back. Ensure inspection from the front, the sides and the back of the joint, comparing both knees, looking for any scars, swellings, asymmetry, deformities, erythema, sinuses and muscle wasting. Now lie the patient flat on the examination couch. Now assess patellar tracking by asking the patient to flex their knee to 90 degrees. Tracking is confirmed as the patella moves in a J-shaped fashion. We will now demonstrate the remainder of the knee examination on the right limb. However, you must assess both sides. First, ensure that the patient is not in any pain and feel for temperature changes with the back of your hand. Now feel for pain, maintaining eye contact with the patient. Systematically examine the quadriceps, patellar tendon, patellar margins, knee joint margins, and collateral ligaments. Check for continuity of the extensor apparatus. Now assess for effusions. Perform the cross fluctuation test by emptying the medial compartment superiorly, then suprapatellar pouch inferiorly, and compressing the lateral compartment. Look for fluid transmission across the joint, appearing medially. Now perform the patellar tap test. Empty the suprapatellar pouch inferiorly, and then with the index finger of your other hand, push the patella downward onto the femur. A spring back is positive. This assesses moderate effusions. Now perform the bulge test. Empty the medial compartment superiorly and then compress the lateral compartment. Look for a bulge in the medial compartment. This assesses minimal effusions. Try lifting the patella between your thumb and index finger. This will not be possible with synovial thickening. Assess for a flexion deformity, placing your hand under the patient's knee and asking them to push the back of their knee down to the couch. Now test extension and flexion actively, asking the patient to bend and extend their knee. Then passively, feeling for crepitus at the same time. Finally, test these against resistance. Ask the patient to perform a straight leg raise to assess the extensor apparatus. Now perform the following special tests, starting with the posterior sag sign. Square the patient's legs with 90 degrees of knee flexion. Maintain this position, flexing the hips to 90 degrees and supporting the lower legs from below. Placing an arm underneath and in line with the ankles. The test is positive when the tibia of the affected knee sags towards the examination couch, indicating posterior cruciate ligament rupture. This is clearly seen as the prominence of the tibial tuberosity, usually visible in the lower leg, becomes obliterated. Now perform the posterior draw test. Square the patient's legs with their knees flexed to 90 degrees. Explain to the patient that you're going to sit on their foot, check that they have no pain, gain permission, and proceed to sit on the patient's foot. Grasp the upper tibia firmly, thumbs placed on the anterior joint line, and apply posterior pressure. Significant posterior glide is positive for a posterior cruciate ligament rupture. Now perform Lachman's test. This is performed with 20 to 30 degrees of knee flexion with the patient's heel on the couch. Stabilize the patient's thigh with one hand and pull the tibia anteriorly with your other. The test is positive if there is anterior tibial translation, and this indicates an anterior cruciate ligament rupture. Continue straight on to testing the collateral ligaments, applying valgus strain to assess the medial collateral ligament and varus strain to assess the lateral collateral ligament. Now perform Mrcs test, placing a thumb and index finger of one hand along the joint line to detect any clicks and pain that is positive for a meniscus tear. Fully flex the leg, then in one smooth motion extend the knee joint. To test the medial meniscus, foot external rotation and lower leg abduction should be maintained throughout extension. To assess the lateral meniscus, foot internal rotation and lower leg adduction should be maintained throughout extension. Now perform the patellar tests. Starting with the friction test, move the patella superiorly and inferiorly, pressing it down against the femur. Next, assess Zolan's test, pressing the patella down against the femur and asking the patient to contract their quadriceps. Now perform the apprehension test, displacing the patella laterally whilst gently flexing the knee. Now measure quadriceps. Measure the circumference of quadriceps bilaterally, choosing a fixed point above the superior border of the patella. To finish your examination, assess for lymphadenopathy, examine the joint above and below, assess distal neurovascular status, ask whether the patient's symptoms affect their quality of life and sleep, help the patient dress, order appropriate radiographs, and thank the patient.